Like I wanted to be a gynae doctor, but I was like, doctor is too hard.
Some people they choose nursing, like just in case, if they change their mind and they don't want to, become a doctor, at least they are in a highly paid profession. From Hong Kong to Canada, and then to Canada to FBNPC.
Man, there's a story to it also. I was gonna go somewhere else.
Okay. And in that movie, there was a desert, and the person is stranded in a desert. And in a
Mhm.
desert, you see mirage, right? I hope
Yeah,
you guys know. In mirage, you see that because of the hot air, you see that reflection, and you see that there
yeah,
is water, but
yeah.
actually there is no water, right? So
Mhm.
nowadays, I know social media and Instagram is like a mirage, right? People they
Mhm.
don't know what's real, what's fake.
That is really a big trap, I would say.
On the exam day, students are like anxious, right? They're panicking. How did you control your anxiety? Hello, everybody. This is Taryn. I'm the managing director for Future Building Nursing Prep Center. And today I'm here with our very special guest, Navjot. And I think Navjot is our youngest student for passing NCLEX-RN exam, if I'm not wrong. But let's just check it out. And Navjot is originally from Hong Kong. So we have brought a very interesting podcast here for you guys, right? So welcome, Navjot, and congratulations for passing your NCLEX-RN exam.
Thank
And
you,
if you
thank
want to
you.
please introduce yourself, like, your background, where you were born, and your education and everything.
Yeah, so basically, I was born and brought up in Hong Kong, and then I finished all my education, primary, high school. That's what it's called here. It's called secondary school in Hong Kong, and then my
Okay.
bachelor's also in Hong Kong, and then I got married, and I just came to Canada this year.
Well,
Couple of
welcome. That
times,
was that
not
was
just
short
here,
and sweet.
yeah.
Tell me more, because I think people want to know more about, like, and of course me too. I want to know more about Hong Kong, right? Like, I guess your parents are originally from India, but how did you feel when you were, like, born and raised there in that country? And if you want to share some of the, glimpse of it.
In my primary school or my secondary school, there was like quite a lot of students from our community, Pakistan, or
Okay.
some from Bangladesh. Like there was like mix, and then also with the local students, the Chinese, right?
Okay.
So that's how we learned our Cantonese. I'm really good at speaking Cantonese, but my writing is like so. I'm not so good in that.
Perfect.
Yeah, there's not so much racism, you can say. The people are quite accepting, and then when I went to my university, I was the only Indian girl in my entire batch. So that was little scary for me, but I think the teachers, the students, they really accepted me. Like, wow, you made it to nursing.
And how was nursing in Hong Kong? Like, is it do they have a degree program? Do they have diploma program? Like, how does that work?
They have all. They have a 2 year diploma. It's
Okay.
called associate degree. I
Okay.
also did that, and then I went to my bachelor's. I did not went straight. My
Okay.
I did my associate degree, and then I entered university. So that's total of 5 years, you can say.
Total 5 years. So 2 years
Yeah,
associate
five.
degree. And then what do you get called the third one? Like the second one is called as degree itself, right?
Yeah, yeah, bachelor's degree.
Wow. And
Yeah.
then do you guys like study the basic subjects there too, like biochemistry and all that stuff?
Yes. Yeah, that's all done in high school. Biochem, and then this it's the same curriculum like just in like Canada. A first year foundation, and then slowly they start building up like year 2, year 3, and you start doing your specialities. In
Yes.
between, they'll add your practicals in like summer holidays, and then like the last year it's full on practicals.
Wow. Just like internship or preceptorship,
Just
right?
like,
So what do you
yeah.
guys call there in Hong Kong? Is it called as internship or preceptorship?
They call it clinical practicum.
Okay,
That's what they
clinical
call it.
practicum. That's the
Yeah.
word they use. Okay, totally
Yeah,
different one,
that's
right?
right. Yeah.
Okay, perfect. And the curriculum, like everything was in English, right?
All in English.
All in English. And when you were doing it, Navjot, did you had something in your mind like you want to become this nurse, like a pediatric nurse or oncology nurse or anything in your mind?
Like I wanted to be a gynae doctor. I wanted
Okay.
to go in that field, But I was like, ah, doctor is too hard. Then I changed my profession entirely. Like, I'm gonna go in nursing now. Then I slowly moved into nursing. But now I also want to go in a gynae ward or like that. Or I don't want to deal with kids, babies, not toddlers, babies. No, I don't want to do.
And we need L&D, labor and birth, delivery nurses, postpartum, right?
Yeah.
And it's nice actually. Our another podcast will come with one of my students. She's working in Toronto in Sunnybrook Hospital as a labor and delivery nurse. So I just did the podcast with her, and it's going to be released. And then so you can probably learn from there. It's amazing what she was sharing with me. I learned a lot, like lots and lots of stories.
Thank
Right.
you.
And another thing is, yeah, you can also become a doctor. I hope you know that, right? In Canada, like you just have to challenge the CAT exam if you
Oh,
ever you are interested, and your
okay.
4 years degree would be considered for that. And then if
Nursing
you,
degree.
yes, nursing degree is going to be
Oh,
considered.
okay.
What the reason I know it, because when I was teaching at the University of Regina here, I had many students who wanted to become doctors, and in order to become a doctor here in Canada, you need to have 4 years of bachelor's degree program, and that can be any bachelor's. So that's why
Okay.
some people they choose nursing, like just in case if they change their mind and they don't want to become a doctor, at least they are in a highly paid profession,
Yeah.
right? Yeah, but then you do
Yeah.
have an opportunity for that. Well, that is amazing. So now tell me, from Hong Kong to Canada, and then from to Canada to FBNPC.
Man, there's a story to it also. I was gonna go somewhere else.
Okay.
Okay. And then I just pray like, thank God I did not go that way. I came to FBNPC right away.
Okay.
I called you guys from Hong Kong. I was already planning it before my marriage. I planned
Okay.
everything. Like I don't wanted to waste my time because I'm still waiting for my PR and I passed my English before that.
So how did you make that detour? Because people who are listening to you, because they are also double minded. Okay, should we go this way? Because nowadays many people are offering this program, right? But
Yeah.
what's different? What made you do that detour that you want to go to FPNPC?
Ma'am, it's the professionalism. Because when I called the ones before for suggestions, I was new. I just saw them on YouTube or Instagram, and they were like quite attractive. It's not like they're not attractive, they're very attractive. And as a new person who really want to know about NCLEX, who I like really wanted to pass it, and they were like, "Oh, tuhi kar loge, you can do it like with us," something like that. I was like, "Yo, I need to call them." I did call them, and then she gave me like average suggestions. The suggestions were not really helpful. And then I got to know about you guys, and then I called you guys, and then I could see a major difference. The
Mm-hmm.
suggestions you guys gave me, like how should I proceed, and I was like, yeah, they know what they're doing. I'm safer here because I know nothing about Canada. I'm new here. And I don't want to waste my 5 years of education, right? I wanted to come into nursing only. I don't want to do something else. That's how I came to you guys.
Thank you for sharing this lovely, beautiful experience. And I want to share a quick thing with you. I was watching a movie the other day, and
Hmm.
in that movie, there was a desert, and the person is stranded in a desert. And in a
Hmm.
desert, you see mirage, right? I hope you
Yeah.
guys know. In
Yeah.
mirage, you see that because of the hot air, you see that reflection, and you see that there is
Yeah.
water, but
Yeah.
actually,
Well.
there is no water, right? So
Hmm.
nowadays, I know social media and Instagram is like a mirage, right? People, they
Really.
don't know what's real, what's fake.
Really, no. That is really a big trap, I would say.
So, what advice do you want to give to the students and FBNPC? What we can do better so that the students they don't fall for the mirage?
I think you're trying your best already. But the thing is, if they really wanted to like try both, they want to try here, they want to try, you just give you guys a call. A call can make a huge difference. A person who is interacting with you, the first impression of like your company or something, some other companies, that can really change where that student want to go.
100%. And I want to
Yeah.
say thank you for giving that beautiful suggestion. There is no harm in giving a call,
Yeah,
right?
like just
One
give a
call can
call.
make a huge difference.
Yeah, that's
Just give a
all.
call.
Yeah,
Yeah.
because there's nothing else you
I
can
am
do.
so proud of you. I'm pretty sure, I don't want to ask your age in the podcast, but I'm pretty sure you are our youngest one to crack this exam, right?
I also
And
think
I
so.
am delightedly super proud. And the different countries are adding into the list of
Yeah.
FBNPC. Now we can proudly say Hong Kong,
Yeah.
right, is the place where the student came from, right?
Yes.
So now coming to, let me bring you back to NCLEX. We had discussion that the curriculum was pretty matching to the Western standards where you studied, right?
Yes.
Then, of course, when you studied here, did you find anything challenging, or it was a review? It was kind of a review for you.
Ma'am, it was a revision as well, but some of the concepts, for example, I studied, but I've forgotten about it already. Because once I'm done with my exams, I'm like, oh, leave it, I'm done. But after like studying, your after listening to your lectures, going modules by modules, I was brushing up, and I knew I had to give this tough exam. And CLEX is not easy, I would say. If
No,
someone have
no,
passed, it's really tricky, ma'am. It's really
it is.
tricky.
It is 100%.
Nothing
Yeah.
is straightforward. For example, I can give a simple example. There was a case study on Marfan syndrome.
Yes.
However, they were not talking about Marfan syndrome. They were talking about sinusitis. I was like, whoa,
Exactly. That's what happens, right?
that's the
Because
trap.
they don't want the nurses here who are just cramming, memorizing, and just spitting out the information.
No.
We need nurses who can connect dots. We need the
Yes.
real nurses who can save patients' life, right? So
Yes.
that's absolutely true.
And that's what you told us. Read the question not once, not twice, but thrice. That's how you're
Yes.
going to reach to your answer. That's what I did in each and every question.
Yes. So that is amazing to hear that. Any study tips you want to share with the students?
Study tip is do not recite everything. You need to understand the pathos, how the pharmacology works, because that really makes things easier. Like you said, if you know the basic, you can connect all the diseases with it. For example, heart, you know the basic, then you can easily know what is congestive heart failure, what is acute kidney. That's like super easy like that. But if you're doing tukka and reciting, I don't think you'll be able to crack NCLEX. Yeah, that's no. Even if you pass it in the future in a real life situation, I don't think that's gonna help.
That's true.
Yeah.
And are you excited to become nurse here in Canada, or you miss Hong Kong?
No, I'm excited for here, for Canada. Yeah.
Another question came to my mind. So let's just say for example, like originally I'm from India, right? So when we get the registration, like Indian states have different rules. Like, for example, when I graduated and then I became a nurse, now my registration is going to be like lifelong active in India, right? So my question to you is, how does it work in Hong Kong? So once, of course, you guys have a registration body there too. Is it active forever, or how does that work?
No, it's not active forever. It's like for 3 years, and then
Okay.
you have to renew it.
Okay.
Yeah.
And
So
then for renewal, you have to work there.
yes, it's a requirement. You have to work there to renew. So I was really rushing myself, just do it quick, quick, quick.
Yeah, before the registration gets expired, right? Yeah, so this is the question because I'm pretty sure there are people like you in Hong Kong because we do have students from South Korea, from Hong Kong, right? That's why I'm doing this podcast with you in English so that majority of the people they can understand this, right? So Kenya, Cameroon, Nigeria. So FBNPC has students from all across, right? And that's why we understand different platforms, how the things they work, right? So I'm understanding a lot about
Yes.
Hong Kong from you
Yeah.
because Navjot is our first student who is joining our program from Hong Kong, right? So that is
I'm
brilliant.
proud to be a
So,
student. That's
thank you
super
so
proud.
much. Navjot, any last tips you want to share with them about the exam date? Because on the exam day, students are like anxious, right? They're panicking. How did you control your anxiety?
Your support system, I would say. Sometimes you really can't control your hormones or what is happening with you. But the person, for example, your husband, your family, that's the support system. They can really calm you down. That's the only way possible.
And I want to congratulate your husband too, because you guys are so young and it's beautiful that, you guys are settling down in this amazing profession, right? So,
Thank you,
congratulations to
ma'am.
both of you and great job in supporting each other. That's how we progress in life,
Thank you,
right?
ma'am.
Yeah. Perfect. Thank
Yes.
you so much, Navjot, for your valuable time. I really appreciate it. Thank you.
Thank you, ma'am. Thank you.